So we have treated him for 7 minutes now. So I'm a bad estimator of time. We did work on every one of those joints that we spoke of. After restoring motion in all joints, including superior tib-fib joint, the subtalar joint was still remarkably restricted. So it's very important to restore motion in the subtalar joint because it is the calcaneus that attaches to the cuboid, calcaneo-cuboid joint. That relationship could not be maintained if we did not restore normative motion in the calcaneus. So when I block motion as ankle here, this is forefoot movement. Now I know that some of that goes above, but here is navicular motion. Hard to see from where the camera is, but this is motion of the base of the fifth metatarsal. This is the cuboid, and this is the cuboid motion integrated with the midfoot. We did work on also restoring superior glide of the fibula, and I'm testing posterior glide of the lateral malleoli, which you did not see before. Blocking again ankle motion. This is subtalar motion. Easier to see with him on his stomach. Could you line your stomach, please? This is what we really wanted to restore, which was, it's called abduction. That's with a B. Abduction of the calcaneus, and that is subtalar joint motion. A little bit of that is in the ankle joint, talocrural. So now this is just isolated subtalar joint motion, and this is so critical to restore. And that is the very last motion that we restored, along with the ability of the calcaneus to evert. Even though he doesn't have much eversion, he still needs this small amount. You know, that's what's normative. And this is the fibular head. I can now push through that fibular head, and the motion goes in that joint, and it goes through the lower extremity, and you can see the foot move when I apply that. You can tell when I'm springing, you can see that oscillation. So would you line your back, please? Did I demonstrate the difference in strength?
I think so.
Didn't we just do that? Oh, didn't we
Not
just
since, no.
pull the foot in, show me how strong you are? Hold it there. Okay, pull it out. Show me how strong you are. Much stronger. Can you stand up? Feels like that eversion is still a little bit weaker, or that it might have reduced endurance.
I know it's still weak.
But feels like progress. All right. Can you stand on the right leg? We got some work to do, don't we?
Yeah, it's just
in terms of balance?
It's just strength and balance, really, yeah.
Okay. Could you just take a walk and give us some feedback? And you made a comment when I was treating you. What was that comment?
Muscle memory?
Or a question or something about treating several joints? I
was curious on how, because I've been like this for so long, so many years, my muscles and ligaments and joints weren't going to want to go back into that position. And you said because you're treating all the necessary joints, instead of just treating one or two like I had done previously.
Uh-huh. And can you give us some feedback?
I definitely felt a lot of, like mobilization as you were working on it, and everything that you were saying and doing made sense to me. And I feel like it does feel different now. It's weird because I've walked the same way for, so long that I have to reteach myself on how to properly walk and how to properly use
You're talking about right now, at this moment.
Biomechanics, yes.
So right now as you walk, you feel like there's a newness to it?
I do. I mean, yeah, it feels good.
Okay. And Mom, any comments about just what you observed?
Just beautiful that I could actually see in a gentle way.
That was what I wanted him to say.
Yeah.
It was about the gentleness of approach. Can you comment on that, please?
Okay. Yeah, I had asked you if you do hard jerks or whips like I had done previously, and you said no, and I was happy to hear that because every time I had done that previously, it was more traumatic. I felt like it injured the actual joints rather than help improve them.
And so the technique that you experienced today, how would you describe it?
It was gentle yet aggressive enough to be beneficial, for sure.
So I think we'll summarize this. There's certainly, work to be done. His foot and ankle has not moved in that manner for I don't know when. I don't know when the last time it moved like that was. I know that a cuboid manipulation helped it, but that benefit only lasted a short period of time.
Correct.
So who knows, when it has last been. Fortunately, every time you weight bear, there is a little movement in that joint. So it does keep the joint lubricated, maybe not on the boundaries, maybe not on the periphery, but there is some movement of synovial fluid, and the fact that we could restore the movement, as you just saw there, was very encouraging. And we have to dig a little bit deeper, in fact, test stability of the joints, make sure that it doesn't lock up because it has too much motion in a certain direction and such. And we need to work on, some of that weakness was neurologically inhibited, so we reduce that inhibition, but you still have to work on building the strength and building the endurance, building the balance, enhancing your proprioception, on and on, desensitizing it. So there's more work to be done, but I feel like it's very, for me, encouraging. I think you can see that in my demeanor and in my voice and such, and as I was treating it and it was altering, I was very pleased that it was malleable. My biggest fear would be, oh my gosh, what if he had a bleed in the joint and I'm not going to be able to restore the motion? But it restored beautifully, and the key is to treat it sequentially. Not to say that my sequence is right, but I would say that a systematic approach that is sequential and, in my biased opinion, saves the very last being the subtalar joint. That was the very last motion that we restored. So, we could argue about what sequence is better. There's no real research to guide us to that, but that's my biased opinion. And the very last motion we restored there was, in fact, the subtalar mobility. So I will, of course, tomorrow continue as we did today and recheck everything and check the hip mobility, check pelvic mobility in a little bit more detail, see if there's anywhere else in your body. I would just bet that you had an inhibited abductor in the right hip. You've seen that in the literature for chronic ankle sprains. And we saw, your mother and I certainly saw that calf atrophy. We didn't capture that on the camera. I'm not sure that we could, but it is visually obvious. So more work to be done, but I think that we're off to a good start. And been a very, very fascinating case. So I sure thank you.
Thank you.